Heads up, medication shortages continue nationwide. The latest, those used to treat ADHD. THV11's Jalissa Garza shares why medical experts say this shortage has been the most difficult one to manage so far.
Last time, it was an antibiotic shortage, which was a big deal because we use amoxicillin for so many things.
Pediatrician Dr. Josh Lyon says for previous shortages, there's been backup options to help. But when it comes to this latest shortage, it's just not that simple.
The issue with ADHD is kids respond differently to different medicines, right? So you can use medicines within the same family for ADHD, but kids will respond very differently to them.
Dr. Lyon says there's different reasons behind the shortage of ADHD medications.
Everybody went back to school, and so we saw this enormous rise in kids who were handling school differently or were having new issues, and so may over the last couple of years have gone undiagnosed in their ADHD. We're attributing that more to increased demand and some decrease in manufacturing from supply chain things.
Pharmacists like Ann Pace doing their best for their patients. She says this has been the most difficult shortage for her pharmacy to deal with by far.
We're at a point where it's just been going on for months and months and months, and it is a daily struggle for us here in the pharmacy because we can't get a lot of those medications.
As Kavanaugh Pharmacy tries to keep their shelves stocked, they're unable to take on more ADHD patients.
We can't increase our volume of dispensing those, or else we're going to have issues getting any more, like I said, because the DEA is so specific on how many we can purchase.
And for those kids unable to get their medication, Dr. Lyon says it can have a drastic impact
on our day-to-day functioning, on our grades. For our teenagers who are out driving, it's a safety function. And so even in those very short periods of time, it can drastically change things for families.
In Little Rock, Jalissa Garza, THV11 News.
Jalissa, thank you. If your family is running into issues getting these meds refilled at your pharmacy, contact your doctor to figure out the next best steps.